My name is Jabulani Mazia. I am an HTC counselor. CHIPS is just an abbreviation that stands for Children HIV Intervention Programme, Swaziland. When it started operating, we happened to find out that there were many adults infected of HIV rather than children. So then we opted to concentrate on children and their caregivers.
My name is Mary Groning. I am a HTC counselor. I'm testing HIV to the patient, and then I drew blood from the patient, and I sent to Good Shepherd's Hospital for the CD4.
So what we do, we have the rural health motivators, where we ask that person to convene a meeting where we can address the people on what we do. Then we ask them to register their names if they want to get tested and know their status.
My name is Delsiwe Mabuza. I was asked by CHIPS to help them help people in the community, and have been working with them for some time now. They helped me start this garden and even fence it. Before, I had a problem with chickens eating my vegetables, but now I can actually get a harvest from my garden and have something to eat. I help by visiting homes in the community and helping take care of those that are HIV positive and need care. In cases where they need more than I can give, I call Jabulani and he helps take them to hospital. I also work with the community in encouraging people to get tested. Already sick patients are taken to Good Shepherd Hospital, and we help patients that are already on ARVs with taking their medication and monitoring their progress.
If we can be able to go to the community, sensitize the community, get them to know their status, and when there is need for healthcare intervention, if they can actually be brought to the nearest health center, in this case Good Shepherd for initiation of treatment, and maybe for Vulane, which is their nearest clinic for continued care. I think it really does make a lot of difference.
My wife would get sick often. We bought all kinds of traditional medicine, but nothing worked. Fortunately, God brought CHIPS to us. They tested her for HIV, got her CD4 count, and started her on ARVs. She is now much better.
I tell my family about the CHIPS bus that takes us to the hospital. If it wasn't for that, I would probably be dead.
Okay, I was lucky to be in the CHIPS program because I even joined the Bible school to get more information about Jesus and knowing more information about the Bible. So when I reached the people there, I found them that they are sick and they are bedridden. So I have to tell them to share the word of God with them, and say some of them will say I accept God, and we will pray with them. Because sometimes you find that some of the people, like Section 19, they called me on Sunday that there's somebody who was sick. So I went there, and then I shared the word of God, and I've prayed with them. And after, when I come back on Monday and find that she's already dead, so with the hope that she has heard my word. Okay, in the community, I started a support group from Section 19 and Matetuga. At Section 19, we've come together as a CHIPS patient, and then we try to meet and see how can we generate money, because when they are going to hospital, everything is money now. If you're taking the Panado is money. So that's why we decided to do the support group, just to generate money. And then I got some donors from Mr. Stevens. Okay, we first melt the wax to the pot, and then we mix with spirit, and then we mix with paraffin, put together, and then we stir. After that, we pour in the containers, and then we sell it.
The need is huge out there, and the only problem that we have at the moment is that we have got limited resources and limited transport. So we have one Kumbi, which can only fit 13 patients. So we can't help everyone at the same time.
This is an essential service for a lot of people who are unable to access service. Whatever their circumstances, they really would love to come to hospital, but they can't for various reasons.
Jabu started in our program about a year ago, and when she started, she already had Kaposi sarcoma, which is a cancer that goes along with HIV, causes the spots on the skin. And to treat this, they have to go through chemotherapy. Chemotherapy can be very difficult with side effects, nausea, vomiting, not being able to eat. She stopped the chemotherapy after a few rounds. She just couldn't handle the side effects. She has just recently restarted the chemotherapy. She's still having difficulty, but she, I think, has the hope to stay. And we are praying with her that God will sustain her, that she'll be able to continue. She did see someone in the hospital last week that was worse than her, that had been going through the treatment and was continuing. It helped her to be able to say, yes, I'm going to continue and get the treatment that I need so that I can get better.
So what CHIPS meant for her was to be the opportunity to access that care and actually survive, to where she can recover from the cancer, be treated for HIV, and actually continue on with her life, whereas otherwise the outcome would have been very short. What you just saw was some examples of the impact that CHIPS is having in the community in Mapuveni and Buvulani. And what we're asking for is continued prayer, but also support, so that we can keep this program going and also expand it into the surrounding communities to help other people as well. Again, we thank you for your time, your prayer, and we would look forward to your prayerful support.